What is menopause? When does it start? How long does it last? What are the physical and emotional changes that women most commonly experience during menopause? Is there any way to minimize or eliminate the uncomfortable parts of it? And how does this affect women's weight?
These are very intense questions. They're not simple answers. I think I should go back and just very briefly touch on the physiology of it all. If you can understand the physiology, then it starts to make sense. Women are born with all the eggs that we will ever have at the time of birth. At puberty, these eggs start to, these eggs start to mature and develop, and our hormone, our major female hormone, estrogen, starts to increase. And the estrogen levels remain high during our reproductive years, 20s, 30s, 40s. Right around 40, we start to deplete all of the eggs that we have, and our hormone levels start to decline. The estrogen level starts to decline. As a result of the declining estrogen level, we start to experience symptoms. The first symptoms that women will typically say is they notice that their menstrual cycles, which have been very regular, are now starting to become irregular. The other sign associated with early menopausal changes are hot flashes and night sweats. We've all heard about hot flashes and night sweats. These can be mild, or these can be very dramatic. I use the analogy of how women experience their menstrual cycles. Some women have no cramps, sail through their menstrual cycle, no problem. Other women have severe cramping, they have to go to their bed. And so it's variable for women, but the reason for it is the declining estrogen level. As the estrogen level drops, all of the receptors in our body, estrogen receptors, start to respond. So we have estrogen receptors in our hair, in our skin, in our breast, all over. They can also, we can also experience changes because of the declining estrogen level. Once the estrogen level is sufficiently low, we stop having a menstrual cycle. And we use that as an indirect, stopping the menstrual cycle as an indirect indicator of menopause. Now, menopause is because we depleted all of the eggs in our ovaries, but not having a period is a secondary effect of that. And so we say, if you have gone a year without having a menstrual cycle, and you are of the menopausal age, meaning that if you're 20 and this happened, that would be abnormal. But any woman over the age of 40 who experiences this, we say this is consistent with menopause. And so anything a woman can do that can help to elevate the estrogen level will help to relieve the symptoms of the decreased estrogen. And so a lot of times women consider hormone replacement, which is different from the hormones that a woman might take if she was using contraceptives. They're both estrogen and progesterone hormones, but birth control levels are much higher than what women would take if they're just doing a hormonal replacement.
Thank you.
I hope that's clear. I mean, there's a lot to take in, but it's a physiologic process. It's not, my concern is that we not think of it as pathology, meaning this is a normal physiologic process. And there are things that women can do that will make it easier. And it kind of depends on your symptoms. There's a recent study that was published in the Menopause magazine, which said that if women followed a vegan diet and supplemented that with a half cup of soy, menopausal symptoms were alleviated. And that's one thing that women can do. Women find if they exercise, if they cut back on alcohol, if they do things like find the peaceful space, do meditative type responses, they can help to ameliorate any symptoms they may experience during menopause. So it is a change, but it's not necessarily bad. And not every woman needs a pharmaceutical in order to get through menopause.
Thank you. Okay, next question. So in terms of multiple sclerosis, what works for this? And is I guess is MS treatable? And I've been told that when it comes to Parkinson's, Alzheimer's, Lou Gehrig's, and multiple sclerosis, that once you have them, then it's too far gone. For people who have MS and are doing okay, they're still walking and everything, but they take drugs occasionally when they have an episode, how much hope do you want to give them? Is there a lot of hope, or is this just, like you'll feel a little better? Like what do you want to say to MS patients about how much progress you believe is possible?
First of all, there's a lot of hope, and there's always hope. I work with a lot of people with MS, and I have seen people go from barely able to move to running. There's Sarah Ramos, if you're here, she posts on Instagram pictures of her doing like mud runs and 5Ks now, where she could barely move when I met her. She did my rapid recovery group, and she thrived, and she's out there sharing it with the world. And that's what's really cool about people who heal, is that we become health missionaries. We can't wait to share what we did and how well it worked, because we want you to feel like we did. I've helped people. I've had one person with Parkinson's do rapid recovery with me, and he was able to lower his medication dose within 4 weeks, and his friends and family noticed visible reduction in symptoms that returned once he added back his standard diet. He actually did it as a favor to his neurologist who wanted to test my program. And ALS has been one that's come up a lot. And I've always said I'd love to work with someone with ALS to find out, because here's the thing, I will not speak to theories, I will only speak to results. And I hadn't had anybody with ALS do rapid recovery where I could watch them and monitor them and make sure they're doing things correctly. And in our previous group, I'm hoping she'll let me share some of her video, because we do Zooms, and I have videos of her talking. She actually had reversal of ALS symptoms, and we were all crying in the final meeting, because it was the first time we got to work with someone on that level with that illness. And to see them come back was just, it still brings me to tears, because that's a disease where there's not a lot of hope given at all. So as somebody who spent a lot of my life sick, I think it's always worth it to do everything you can. Listen, I was told that I'd be disabled in my 40s. I'm 45 and I feel amazing. I was on cover of, Fit Over 40. I don't really care about that part as much as my body works, and I was told it wouldn't, so I still think it's worth doing everything you possibly can to take care of yourself. And if it's just going to slow the progression, or if it's going to bring you back, then it's still worth it, right? So sometimes I do see people where they're already in a wheelchair and they've got really serious issues going on. And I'll tell them, I don't know if we're going to get you walking again. It really depends on, if say there's still inflammatory lesions, or if these lesions are already set, and that's going to be a disability you already keep, but we're going to prevent the new ones, right? But I have had 3 people now retake MRIs after doing our rapid recovery group, and all 3 of them had no new lesions and regression of the most recent lesion. And in every single case, the doctor that was reading, the radiologist that read the report said, maybe it wasn't a real lesion, maybe it was just a mistake, because those lesions don't go away. So that was also really exciting, as we, while most people don't get them often, we did have 3 people who tested and saw that result. So we do know, even looking at MRIs, that this disease is reversible, and at least the most recent lesions can possibly get better, and you can stop the progression, which is really, really important in diseases like this.
Thank you. We touched.
Oh, wait, check this out. Look, Diana just wrote in the comments, MS in remission for over a decade because I added hyper-nourishment, which is my protocol, and she regained her full vision back. So there you go, from the seats out in the audience. It works.
Great, thank you. We touched on this, but for women who feel they need it, do you recommend 1 hormone replacement therapy, 2 bioidentical hormone therapy, or 3 neither? What is your general thought on this for women who feel like they need something?
It depends on the woman. It's a situation where you have to tailor it to the woman, her needs, and her personal preferences. There are some women who have a great fear related to taking estrogen, progesterone. And partly that's due to the media and the thought that it would increase your risk for breast cancer. There's some women that are in the total opposite extreme who come in actually asking for it. And what we have to deal with is the issue of quality of life. Similar to MS and other conditions, we are really talking about how do we live life in a way that's optimal for us. And so there isn't a cookie cutter answer to that. It really has to be tailored to the woman. And so I have women who are taking estrogen and progesterone. I have women who are taking progesterone only. I have women who opt not to take any hormonal replacement. The issue of bioidentical kind of came about because, how can I say this? I think the obstetrician and gynecologists kind of were dismissive of women and their symptoms. And then Suzanne Summers came out with a book and she started talking about bioidentical hormones. And the thought was that if I take a bioidentical hormone, it's not going to hurt me versus the hormone preparations which have been given to women. The number one being Premarin. Premarin is a hormone that's derived from the urine of pregnant horses. And so the question is, why would I want to take the hormones from a pregnant horse? I'd rather have a bioidentical hormone. And women started gravitating towards this. The American College of OBGYN has said that there's no proven benefit of bioidentical to synthetic hormones. Most women don't buy that, quite honestly. And so the problem with bioidentical is that often, because there weren't preparations for that, women had to have these medications compounded. And the problem with compounding these medications is there's no regulation, there's no guarantee that you're actually getting what you think you're getting. And so for that reason, the emphasis was placed on, no, you should use pharmaceuticals which have been approved by the FDA, because then you know exactly what you're receiving. Just recently, there's now a bioidentical hormonal preparation that's been put on the market that doesn't involve compounding. I say all to say that it's been a mess. And it's been a lot for women to comprehend and to take in. But the bottom line is, first of all, do you need hormonal replacement? And that's dependent on your symptoms. And if you do need, then what makes the most sense for you? Do you want to take a pill? Do you want to take a cream? Do you need something slowly for the vaginal area? And all those things have to be factored into the equation, which is why I say the answer is it depends and has to be tailored to the woman and her symptoms.
Thank you. This question is for men and women. A lot of us are very concerned about heart disease, and we take that seriously. We don't smoke because we don't want lung cancer. And we're concerned about diabetes because we want, our pancreas, we want to be protected. What do we need to know about our thyroid? This is kind of like we'd rather not have to worry about another thing. Is this something that we have to take care of? Are we supposed to be thinking about this? Is this a real issue that a lot of people have? Every now and then, I'm usually not thinking about it, and every now and then someone says something about the thyroid, and I start thinking, is this something we're supposed to know about? So are we supposed to be knowing, thinking, doing anything about our thyroid? Anything to say about that?
Well, I think that you don't have to think about all your separate parts when you're taking care of the body as a whole. So, a lot of times people want to know, what's the best diet for heart disease versus diabetes versus autoimmune disease? And there isn't. There is an optimal diet for human health, right? And when we take care of our health by eating in the optimal way, everything is better, right? So I haven't had to, while I do specialize my protocol for people who have impairments that require it, right? Like I've reversed Crohn's disease and ulcerative colitis, but in those folks, I often have to take a stepwise approach because they can't stop with the diarrhea and bleeding. So we can't just feed them the way I'd feed someone else, right? But the optimal protocol that we're aiming for is the same. Same thing with kidney failure. If you can't process your food properly and your potassium is going to spike, I have to change it. But it doesn't change what the optimal diet is. We just had to change it based on your current organ function. So for the thyroid, it's going to be the same thing. And so I've helped people reverse both Graves and Hashimoto's using the Hyper-nourishing Protocol and plant-based diet, and they get healthy. The one thing that does need to be paid attention to in thyroid disease is iodine intake, something that I discovered a few years back. I was trying to figure out why all of a sudden I'm seeing the surge in people who have symptoms of thyroid issues, even without any antibodies. And what is going on here? And so I was obsessing about it, and I realized something. I realized that a lot of the folks that I see have been they are people who are trying to search out health, and they're Googling and they're, learning about it. And one of the things that comes up a lot is there are people who say all salt is bad. So they stop eating all salt. And then others who switch to sea salt, and neither of those have iodine. So a long time ago, they started adding iodine to salt because it was something that all people ate. And it was an easy way to deliver this nutrient that's important for brain function and thyroid function. Now people are suddenly not consuming it. So over recent years, I've actually brought that back to people to pay attention to that because they will start they'll eat the healthiest they've ever eaten. And then suddenly their hair is falling out, their skin's getting dry, and it's because they gave up their iodized salt. And so it's actually impacting their thyroid. So I do actually encourage people to have some sodium in the diet because I'm also hyper-nourishing with high hydration. So if you're drinking 96 ounces or more water a day, you actually need a little sodium to have your blood concentration be steady. But if you're going to use something like your Himalayan special pink salt, whatever, you are going to then also need something for iodine, either 2 sheets of dehydrated nori a day or an iodine supplement. And the range that had been shown to be effective for thyroid health for the general person, about 150 micrograms a day. For people with Hashimoto's, 300 micrograms a day, but not more. The studies have shown that if you go higher than that, you actually cause more problems rather than help it. So that's one thing I would add to just an overall healthy diet and way of living, is to make sure that you do get that supplement in your body one way or another.
I would also add that hypothyroidism tends to increase in its incidence with older women. And so older women need to have their thyroid function checked. And a lot of the symptoms of hypothyroidism, hot flashes, night sweats, mimic these changes that we think are associated with menopause. So you may be calling one condition, diagnosing it incorrectly, thinking that it's menopause, but it might be related to your thyroid.
That's a super good point. That happened to my mom. I was actually only a resident at the time, so I didn't know all I know now about nutrition. And she felt depressed and she was gaining weight for the first time. And the doctor kept saying it was menopause. And it turned out she did have menopause and she had Hashimoto's at the same time. So yeah, that is definitely something that happens for sure. And that happens a lot in general. The thyroid disease can show up in a lot of ways. And sometimes the first symptom is depression or anxiety. And people will be sent to the psychiatrist rather than checking their thyroid levels. So I do think it's an important thing to check for, in addition to just taking care of yourself in every way.